Keep up to date everywhere. News Talk 820 WBAP.
In the WBAP newsroom.
Somebody else who is here to help, and I actually got some email on this yesterday, asking about the guy that we used to talk to all the time about concierge medicine and why that's not talked about more as part of solutions to our Obamacare crisis. And I said, you know what? That's a great point. We haven't talked to Dr. James Pickney in an awful long time from Diamond Physicians. He was kind enough to set aside some time, or rather his wife was, from their vacation. Dr. James Pickney joining us on the line right now. Welcome back to the Salcedo Show, sir.
Hey, Chris. Good morning.
Nice to have you on. I want to first off just get your, if you will remind folks what concierge medicine is.
Well, absolutely. You know, I like the term membership medicine. We're trying to figure out a way to affordably distribute a new healthcare delivery model. So what it is basically is one capitated rate, one low monthly fee, unlimited visits, no copay, 24/7 access to your doctor. So you have your doctor's cell phone, their email, you can text them whenever you like, and we've included unlimited urgent care. Now, what we've gone out and done in Dallas and across the nation is build a cash pay network for ancillary services. So for labs and imaging, you actually have an 80 to 90% discount. So think of us like the Costco of medicine. We're a wholesaler. So you have this membership fee that gets you access to all these great prices, plus true affordable health care.
Now, imagine, if you will, folks, and this is where I thought that what Dr. James Pickney does at Diamond Physicians and what Donald Trump is attempting to do, which is to resurrect an actual market in health insurance. Just picture this, and Dr. James, I want you to weigh in on this combination. You buy a inexpensive catastrophic loss policy, which, by the way, isn't available anymore because Obama and the Democrats destroyed inexpensive catastrophic loss policies. And for those of you who don't know what this is if you get the cancer diagnosis, or that you get hit by a bus or something that's unexpected, the catastrophic diagnosis or problem medically speaking. But and that covers you in case the unthinkable happens. But you've got Dr. James and his concierge medicine that you're paying a low monthly fee for to his service to take care of all of your medical needs, like your checkups, and you get the sniffles or what have you, or an infection. Then Dr. James is there for you. Dr. James, is that not the most potent, most cost-effective use of the consumer's dollars?
It is, Chris. You know, we've been talking about this for 3 years, and I'm happy to see that the government is starting to rally behind this movement, especially with HSA accounts and allowing tax-deferred money to be utilized for membership medicine. I hope that bill goes through. But that is by far the way insurance should be utilized. It's the way insurance was designed to be utilized. We want to use it like we use our car insurance. When you fill up your car with gas, Chris, you pay cash. You swipe a credit card. When you need new windshield wipers, new tires, you pay cash. If you get in an accident that costs thousands of dollars worth of damage, that's when you file an insurance claim and you pay your deductible. That's why car insurance premiums are relatively low. Now, we've gone away from that with medical insurance, but we have to get back to catastrophic coverage and cutting out primary care and paying cash. Because when you pay cash for a flu shot, it costs you $6 in our office. When you use insurance, it costs you $65.
Yeah, and it's, boy, Dr. James Pickney, everybody, with Diamond Physicians is our guest right now, and he has been one of the leaders in concierge medicine, what I believe is the solution to getting government the heck out of health care. It doesn't belong there. Let me play devil's advocate with you, Dr. James, if I can. You will always hear individuals. As a matter of fact, I got an email from somebody who skews left here just moments ago, who says that people strutting around with their sodas as some sort of demonstration of freedom. They get out there and they ruin their bodies and they don't get preventative care, and then it's up to the American taxpayer to foot the bill when they get sick. What is your answer to individuals like that?
Well, the current system is based on sick care. When you need medical services, you go out and get them. So we have to remodel the way people think about their health care. It has to be proactive instead of reactive. So you have to go to the doctor once a quarter to stay healthy instead of waiting till you have a chronic disease, diabetes, hyperlipidemia, high blood pressure, then try and fix it. We want to prevent these things in the first place. So people can reroute their thought process and say, okay, you know what? I'm going to be on this earth for 60, 70, 80 years. Let's figure out a way to maintain my body just like we do our car vehicles, our automobiles. You go and get an oil change every 6 months. If you don't, your engine will seize, and it's going to cost you thousands of dollars. Well, your body should be treated the same way, if not better, because you only have one heart, one set of kidneys, one set of lungs. And once they're gone, you can get a transplant, but you're still going to have a lot of problems down the line.
What's your take on the current debate, but mostly among Republicans, because the Democrats just are out there with the illusion that Obamacare is the greatest thing that's ever been. So the Republicans are debating how to get rid of it. That you and I know is a cancer on the United States of America. Where do you think this debate ought to go? Are you with what the establishment Republicans are putting out there? Or are you more in line with the Jim Jordan folks who say let's just repeal the dang thing and start from scratch?
Oh, we can't start from scratch, Chris, because the Affordable Care Act cost us $4 trillion to legislate. So you have to make it better. Take some of the things that are good about the bill. I do like the fact that there's no pre-existing conditions. I hate the mandate. We can't force an inferior product down the throats of all Americans. There has to be choice. So we need to get back to the free market. We have to have competition that will drive price transparency and drive prices down. So I think with these HSA accounts and allowing tax-deferred money so you can charge up your HSA or FSA account and then pay for medical services that you choose, I think that's the right direction. And there's supposed to be some tax credits involved with this new bill. There are probably going to be a lot of Americans, though, that will lose their insurance completely. That's going to be very difficult. Texas is a very high uninsured state, high Medicaid presence. There's going to be federal cuts. So a lot of people aren't going to be able to have health care. So we need things like membership medicine and Diamond Physicians to give people an outlet, because it truly is, Chris, it truly is health care.
Well, you know what? Let's give that web address so folks can get in touch with you and what you do, Dr. James.
Yeah, go to diamondphysicians.com. We've got 3 locations in Dallas, Frisco, North Carrollton, and the Preston Center, and then we're opening a location in Atlanta in the fall.
Well, thank you for coming on to the program. Thank your wife for giving us some of your vacation time, man. We appreciate it. We'll get you back on soon.
Oh, thanks for having me on.
That's Dr. James Pickney, everybody, from Diamond Physicians here on the Chris Salcedo Show. We're live at the Plano Center, putting Texans back to work job fair.